5 Psychotherapy goals that increase therapy effectiveness. Collaboratively establishing goals with clients in psychotherapy is vitally important as the common factors research has found. However, collaborating with clients to create the goals for the therapy isn't a magic wand, and in fact, if that is the only factor considered in establishing goals, the therapy can be misguided from the start and not maximize the possibility that the therapy will have a good outcome. In this video, I will cover 5 goals to improve therapy and better help clients overcome the impediments that hinder or even sabotage the client in reaching outcomes that improve the client's quality of life. Goal 1. First, it is not the therapist alone who establishes the therapy goals. One major, essential characteristic of an effective goal, or effective goals, is that it is the product of a collaborative process between the therapist and client. If not, problems can arise very early in the therapy. 1. If the goals are generated solely by the therapist, they may not be fully relevant to the client and the details of the client's life. 2. If the goals are generated solely by the client may choose goals that may actually hinder the client in reaching the client's desired outcome in therapy. The therapist must learn from the client about the client's values and their desired outcome of the therapy. The therapist is valuable to helping the client reach that desired outcome if and only if the therapist is knowledgeable about the nature of effective goals. The client may not know how to differentiate from effective and ineffectual goals in light of the client's values. Setting goals are best if done collaboratively. Goal 2. The result of the collaboration between the therapist and client with respect to therapy goals is best if the goals collaboratively created are generally approach goals rather than avoidance goals. What does this mean? Approach goals are goals that are aimed at facing and taking on a challenge in life, something that is viewed as an obstacle to having the life desired by the client. Avoidance goals are goals that are aimed at avoiding an obstacle in life rather than proactively taking on the challenge. Far too often, the goals agreed upon by the client and therapist are designed to avoid a challenge. Examples of such goals include: avoid feeling anxiety or depression and avoid people, places and situations that are seen as risks to sobriety. We typically call these triggers. Please note that an early goal in treating a serious addiction, whether a substance addiction or a process addiction, may be an avoidance goal, and that makes sense. However, if that avoidance goal is a goal throughout the process of therapy, it can interfere with the client living a wider, richer life in which the client faces the challenges in life rather than avoids challenges. Generally, however, avoidant goals maintain the client's perception of overwhelming threat in the world or in the client's environment, and the client's perceived inability to face the challenges in the client's environment. An approach goal will help the client's world become larger and decrease the perception of overwhelming threat. Goal 3. Better therapy goals are those that are realistic. For example, if a client presents in therapy as struggling with major depression throughout the client's life, it would not be realistic for the goal to be depression-free in a short period of time. If that is the goal, and the client has dysfunctional beliefs about having another depressive episode, such as having a depressive episode would be horrible and evidence of the client's weakness to face life, then having the unrealistic goal is a setup. It would be better for the goal to be realistic, such as, initially I want to decrease the frequency of depressive episodes from 1 a month to 1 every 2 months. Or a realistic goal would be to increase episodes of sadness rather than depression. This is not a semantic difference, but within REBT, sadness is a functional negative emotion while depression is a dysfunctional negative emotion. What is the difference? A functional negative emotion, while not pleasant, does not interfere with attaining life goals, while a dysfunctional negative emotion is not only unpleasant, it tends to interfere with attaining desired life goals. Goal 4. Some clients who commonly experience dysfunctional negative emotions, such as depression, anxiety, hurt, guilt, jealousy, envy and rage, want to have as a goal, not feeling anything. What some therapies call a dead man's goal. While it is understandable for such an individual to desire feeling nothing over feeling deeply painful emotions, a dead man's goal isn't viable. Why? A better goal would be to work on identifying and changing dysfunctional negative emotions to functional negative emotions and perhaps eventually positive emotions, that is, face and replace as best one can the dysfunctional negative emotions and not inordinately disturb the self when they do experience a dysfunctional negative emotion. A caveat here is that many clients will view positive emotions as good and negative emotions as bad. However, a positive emotion, such as joy, peace, happiness, calmness, etc., can be dysfunctional. For example, if a parent has a child with a very bad and unsafe fever, and the parent experiences happiness, this would be very dysfunctional. A better emotion would be concern, which while not pleasant, would be more functional, whereas experiencing anxiety, a dysfunctional negative emotion could impede the parent from taking appropriate steps to reduce the child's fever. In this case, the anxiety and the happiness would be dysfunctional, but the functional negative emotion, concern, would be helpful and appropriate. Having as a goal, not to feel any emotion, would yield a life without joy, peace, and happiness. Better to face the dysfunctional negative emotion and over time replace them with functional negative emotions and the ability to live life without perceiving negative emotions as overwhelming threats to meaning and purpose in life. Goal 5. An important goal is to identify and replace dysfunctional negative emotions and dysfunctional behaviors rather than decrease the intensity of the emotion and behaviors. Why? While it seems reasonable to want to dial down the intensity of a dysfunctional negative emotion, the cause of the dysfunctional negative emotion may not be fully addressed. For example, some people want to use distractions to decrease the intensity of an emotion, but the dysfunctional inferences and beliefs causing the dysfunctional negative emotion is not addressed. A client who experiences deep anxiety that is caused by the attribution of overwhelming threat in their environment accompanied by dysfunctional beliefs, such as, "My anxiety shouldn't be this intense. It is horrible and I can't take it. And I am utterly weak to face the world and perhaps even, the world is horrible and filled with threats," will be predisposed to ongoingly experiencing anxiety. Dialing down the intensity of an emotion doesn't address the dysfunctional beliefs causing the emotion. There are other psychotherapeutic goals that help a client better face life's challenge and maximize the possibility of attaining desired life goals rather than running from life and living a safe, small world without joy. I will consider additional effective goals in another video. For more REBT-related videos in the form of lectures, workshops, and expert REBT therapists using the model and live therapy, consider subscribing to this channel, REBT Education and Training, or go to the website of the Albert Ellis Institute, the international home, headquarters, and heart of rational emotive behavior therapy.